Hello, I'm Tara Cameron, and thank you for this opportunity to present my proposal on granting full practice authority to nurse practitioners in North Carolina. Today, I will discuss why this change is crucial for improving healthcare accessibility and efficiency in our state. Nurse practitioners, or NPs, are advanced practice registered nurses who typically hold a Doctor of Nursing Practice, DNP, or a Master of Science in Nursing, MSN. A DNP is becoming the most commonly held degree among NPs today. They provide high quality healthcare services, diagnose, treat, and manage illnesses and conditions, and promote overall wellness. Currently, North Carolina requires NPs to work under the supervision of a physician. This regulation limits their ability to practice independently, reducing the accessibility of healthcare services. The American Association of Nurse Practitioners highlights the need for effective advocacy to support NP practice, which is what we aim to address with this proposal. Let's explain what the scope of practice authority is. It falls into three main categories, or levels, of practice authority: full, reduced, or restricted practice authority. Full practice states, the blue, light blue, NPs can perform the full scope of their practice without a supervising or collaborating physician. They can diagnose, order tests, prescribe medications, and operate their own independent practices. In reduced practice states, the purple, NPs can perform some of their scope of practice without a physician's supervision. They can usually operate their own practice or prescribe certain types of medications. They are rarely involved in ordering tests and diagnosing conditions. In restricted practice states, the navy blue, NPs must work under the supervision of a physician for all of their scope of practice. They are not allowed to act as independent practitioners. Now let's take a look at the map of the United States and where each state falls within those three categories. Full practice states, remember, light blue equals 27 of them. The reduced practice states, purple, 16, and the restricted practice states, navy, 11. As you see, it includes North Carolina. If you just did the math in your head, you are correct. That does add up to 54 and not 50. That is because it also includes the additional jurisdiction of Washington, D.C., which is a full practice state, as well as the three U.S. territories of Guam, which is also full practice, and the U.S. Virgin Islands and Puerto Rico, which are reduced practice states. As we are advocating for autonomy, this proposal will take us through the previous solutions attempted, the proposed solutions, the outlined public awareness campaign, legislative efforts, proposed pilot programs, the feasibility of the proposal in regard to financial, legislative, and overall benefits, and the call to action in regards to stakeholders, benefits, and the expected outcome from the proposal being enacted. Several solutions have been attempted to address the problem of restricted NP practice authority. This agreement model requires NPs to enter into formal agreements with MDs, imposing significant financial and operational burdens. For example, for one NP, she had to pay $500 a month for minimal supervision, plus additional fee of $5 to $20 per patient file reviewed, as well as a portion of the supervising physician's insurance policy. Efforts to increase the number of MDs in underserved areas through financial incentives and loan repayment programs have also failed to meet the immediate healthcare needs due to the high costs and long training periods involved. Additionally, while telemedicine has extended the reach of existing physicians, it cannot fully substitute for in-person healthcare services. The proposed solution is to grant full practice authority to NPs, allowing them to practice independently and improve healthcare access and efficiency. This plan involves a public awareness campaign, stakeholder collaboration, drafting and lobbying for legislation, and pilot programs in underserved areas. This comprehensive approach aims to educate the public and legislators about the benefit of granting full practice authority to NPs and to build broad support for the legislative change. The public awareness campaign aims to educate the public and legislators about the benefit of full practice authority for NPs and to address the misconceptions about NP training and expertise. Strategies include distributing educational materials, hosting public forums, engaging with the media, and leveraging social media platforms. Key stakeholders include the Nurse Practitioners Association, allied health organizations, legislators, public relation firms, social media influencers, patient advocacy groups, and academic institutions. Their involvement is crucial for the success of this initiative. Drafting legislation is a critical step. We will seek pro bono legal services for this task. Lobbying efforts will focus on persuading lawmakers of the benefits of NP practice, of NP independence, and mobilizing public support through campaigns. The timeline for this process may take up to 2 years. Funding for these efforts will come from healthcare grants, donations, crowdfunding, and contributions from federal and state health departments and private healthcare foundations. Securing these funds is vital for the campaign's success. Pilot programs will demonstrate the effectiveness of full practice authority for NPs. These programs will be implemented in select areas of North Carolina, monitoring outcomes to provide evidence for statewide practice. Expected outcomes include improved healthcare delivery and stronger support for legislative change. The financial feasibility of this solution involves securing several $millions for advocacy, public relations campaign, and pilot programs through healthcare grants, donations, and crowdfunding. Legislative feasibility requires drafting and introducing a bill, mobilizing support from legislators and stakeholders, and lobbying for these benefits of NP practice. Effective lobbying and public advocacy are essential for legislative success. The benefits of granting full practice authority to NPs are significant. Improved healthcare delivery and outcome, along with potential annual health cost savings, estimated between $433 million and $4.3 billion, make this initiative highly feasible and beneficial. Granting full practice authority to nurse practitioners in North Carolina is a viable solution to improve healthcare access and efficiency across the state. By allowing NPs to practice independently, we can better meet the healthcare needs of our population, especially rural and underserved areas. This proposal calls on stakeholders to support this critical legislative change and enhance healthcare delivery and outcomes in North Carolina. Today, we discuss the challenges and solutions for granting full practice authority to nurse practitioners. By implementing these solutions, we can work together to make a positive change in our healthcare system. Thank you for your attention. And if you have any questions or if anyone needs further information, please feel free to reach out to me.